Okay, welcome everyone, and thank you for joining us on this Zoom webinar today. I'm Dr. Teresa Hodgkins, and I am the Vice President of Clinical Quality Initiatives at Desert Oasis Healthcare, and I'm also very proud to serve as the current Board President for our HARC's Board of Directors. As such, I have the privilege of welcoming you all to this momentous once every 3 years event. Today, you'll get to hear about a very unique and valuable organization, HARC, and the data they collect to make our community healthier and stronger. I'm very proud to be a member of the HARC board because I know, as a pharmacist and healthcare provider in our community, that you can't improve the health and wellness of our Coachella Valley if we don't regularly measure it and measure the progress we are making for improvement. And now I'd like to introduce you to Dr. Jenna LeCount-Heinle, who has been with HARC for a decade now, with 8 years as the Chief Executive Officer. Jenna has been instrumental in growing HARC into a thriving nonprofit in our community. Since she joined, HARC has more than doubled in size, both in terms of staff members and in terms of budget. And so it is my great pleasure to welcome Jenna to our virtual stage.
Thank you so much, Teresa, for that warm welcome and for being our wonderful board president. We are so thrilled to have the great relationship we do with Desert Oasis. So thank you all for joining us today. As Teresa said, I'm Jenna LeCount-Heinle, and I have the privilege of being the CEO of HARC. I'm very excited to share this with you all today. And so let's dive right in. So I want to start with the introduction to HARC, and let's start with our very first poll. I want to know who on this webinar is already familiar with HARC. We're interested to see, and I know this may be something that you're don't fit into any of these buckets perfectly, but choose the one that best reflects your relationship with HARC. Is it the first time that you've really interacted with us? Are you familiar with us in general, but haven't really used our data or our services? Or are you one of our friends that we interact with on a regular basis? Okay, I'm gonna give it another few seconds before I close this poll. And oh, thank you. You guys are wonderfully participatory. I love that. So I'm gonna end the poll and share the results with you. It looks like most of you are friends who are very familiar with us, but there's some newcomers as well, which I'm thrilled about. And for those of you who are familiar in general, I hope we move you into the very familiar category soon. All right. So HARC is a nonprofit 501c3 organization founded in 2006. I am not the founder. That distinction goes to Eileen Packer, Glenn Grayman, and Wayne Susi, who built us a beautiful nonprofit that is now growing and thriving. HARC strives to improve community health, well-being, and quality of life through data. So we're data geeks, all of us, and our services really fall into two primary buckets. There's the Coachella Valley Community Health Survey, which is why we're all here today. But we also do consulting services regarding research, evaluation, anything you want to hire a data geek for. So before we dive into the Coachella Valley Community Health Survey, I wanted to dive into a little bit of some of the cool research and evaluation projects we've been doing. So one project that we've recently are still in the midst of is with the County of San Diego. We're working to do a gun violence reduction community needs assessment. It includes a lot of listening sessions with the community, surveys in multiple language, and a lot of community outreach. We're also working with the California Institute of Regenerative Medicine. Some of you on this call may have been invited by Casey to attend a community listening session next week with the idea of making clinical trials more accessible to underserved people. That is, those who are rural, English as a second language, or low income. We've just wrapped up a wonderful program evaluation for the nonprofit Starting Over, evaluating their Housing First program for formerly incarcerated adults and how that changed people's lives. We are fortunate enough to have multiple projects with the Center for Health Disparities at UC Riverside. We're very lucky to be affiliated with them, but we have one that's just about to start that's a study of asthma symptoms for people living close in around the Salton Sea and how that aerosolized playa and lake bed really affects their respiratory health. We also recently completed a traumatic brain injury or TBI needs assessment for the California Department of Rehabilitation. That looked at not only people who are living with a TBI, but their caregivers and their healthcare providers to give us a real 360 view of their needs and what services could meet those needs. And last but absolutely not least, we're working with our friends at QueerWorks and DAP Health. They're piloting a universal basic income project for low-income people residing in Palm Springs. And we're very excited to be the evaluators for that new project. So that's just a few of the projects that we're working on. And now I want to introduce you to the people behind the scenes who are making all this wonderful research happen. First, our Director of Research, Casey Lear. Casey, wave to the crowd. I'm sure many of you know her because she's been with us for a very long time and has done a great job of managing our staff and these projects. We also have Chris Morin. He is our Senior Research and Evaluation Associate. Chris is the epitome of a pipeline success story because he started at HARC as an intern and then a part-time staff and then a full-time staff. And then this year he was promoted to a senior associate. So we're very grateful that he continues to grow and thrive with HARC. Speaking of growth, Dr. Daniel Polk. He joined us about a year and a half ago, and we are so thrilled to have him. He's originally from the Morongo Valley and very dedicated to serving this community. Teresa Saimai, who I know many of you know, because I'm pretty sure she knows everyone. She's our administrative manager and makes sure that the lights stay on and we get paid and our checks don't bounce and all the important things. So she really runs HARC with the assistance of Nicole Smith, our newest employee. She's our administrative assistant, and she's also the data entry specialist. So she is the one who turns all of the paper surveys into the wonderful magical data that you will see today. Nicole, jump on camera for just a second and wave at everyone. Hi, Nicole. We also are fortunate to have a research and evaluation assistant. Our current assistant, Amairani Ramos, is instrumental in making this event happen. She is about to go off to the next phase of her life and join a graduate school. So starting tomorrow, we will have a brand new research assistant joining our team. They're going to overlap for a week. His name is Bernardo Lino. He is from the Coachella Valley as well, and I look forward to introducing him to all of you in the near future. HARC staff aren't the only ones making this magic happen. We also have a wonderful board of directors. You already met Teresa, but our other board members are equally wonderful and magical. We have Christy, Veronica, Cecilia, John, Blas, Syra, Lucy, and Bill. We could not do what we do without you. We are so pleased to have a board that really prioritizes people who engage and represent underserved communities. And we are one of the few nonprofits that are proud to say that over half of our board are people of color and over half are women. So we really enjoy having a board that truly represents the people we serve. So now I'm going to give you some background on the Coachella Valley Community Health Survey in general, and then we'll dive into the results for this survey. So the history was that organizations in the Coachella Valley were frustrated because there wasn't good data here to tell our story. As all of you know, Riverside County is huge, right? It's bigger than some US states. And so the countywide data that was available was great, but it kind of masked our issues, our problems, our needs, because it's heavily skewed by the people in West County because there's so many more of them. So HARC was formed to solve that issue and to do a Coachella Valley specific survey. The first one launched in 2007. We do these every 3 years. So today you'll be seeing the first results from our 6th survey. And guided by a steering committee of local organizations, it was determined that the survey should be a random sample. This is important because it's really the gold standard in surveys to best represent the whole community. Again, we decided we'd do it every 3 years because health changes and you want to stay on top of those trends and measure change over time. Given our community, English and Spanish captures the majority of the community. It should include information about adults and children. And we need a large enough sample size to really draw good conclusions, so at least 2,500. The survey topics aren't driven by a theory or a model or something like that. They're driven by the community, and by the community saying, I need to know this information and I can't find it anywhere else. So it shifts a little bit over time. These are some of the survey topics that are on there this cycle. But we have to manage this balance of asking the same questions again and again so we can track change over time, adding in new and important questions such as COVID-19 as they become relevant, and of course, not making it a humongous survey that's overburdensome on our participants. So now I'd like to do another poll with you all and hear from you, what are the topics you are particularly excited to hear about in this 2020 data? So we have a lot of topics because there's a lot that the community wants to know. So you have a lot of options to choose from, whether you're interested in the healthcare access and utilization and prevention, health behaviors like smoking or drinking or marijuana use, COVID-19, which of course this is the first survey that captures that, chronic disease, mental health, disability, obesity, sexual health, HIV testing, food insecurity, and socioeconomic needs. Some of our newer data about racism, intimate partner violence, environment, and air quality, or some of the data that's specific to the child survey, learning and socialization and education. I love seeing you all participate, so thank you. I'll give it another second. Okay, let's share the results. It looks like the most popular topic you guys are excited about is healthcare access, utilization, and preventative health screenings, followed closely by chronic disease and mental health, and food insecurity and socioeconomic needs. Oh, good, you've got some exciting surprises, possibly, in our upcoming topics. All right, so generally speaking, with our survey, we collect the data, clean it, weight it, and analyze it, and then give it back to our community because it belongs to all of us. We report it out in a wide variety of manners, including the executive report that you'll get to see today, special reports, data briefs, infographics. We do guest lectures, media appearances, the whole 9 yards. As much as we can do to get this information out there is our effort. Who uses our data is illustrated by the wonderful people who are on this call, mostly other nonprofits, hospitals and healthcare organizations, funders and foundations. It's also used by the media, education, local government, elected officials, our local county, basically anyone who's a local leader who's trying to improve health and wellness in our region. The uses of the data are numerous. A lot of people use it to prioritize needs in the community because as much as we would all like to improve every single thing, we have to focus it. So this helps to look at what are the greatest needs. It's been used in strategic planning, program development, and applying for grants or other funding to support those programs. It's been used in several assembly bills to make or change policy that will benefit our community. It's been used a lot for education, so presentations, articles, trainings, etc. So teaching people who lives here and what do they particularly need. Because we're a nonprofit and always thinking about funding, I especially like to highlight what other nonprofits have done with our data. I know Jack Newby is on this webinar, and Jack, I love this story and I tell it all the time. Jack said to me that when he was applying for funds to support the Meals on Wheels program for home delivered meals for low-income seniors, outside funders would see his application and think, oh, Palm Springs area, it's a bunch of rich white guys playing golf. And there are a bunch of rich white guys playing golf, but there's this other story too of these thousands and thousands of low-income seniors who without programs like these would not be able to eat. And our data helps document those thousands and thousands of food insecure low-income seniors so that he could tell that other side of the story. It's a very compelling request when you can document it and back it up with third-party data that HARC provides. So we are so thrilled that all these wonderful organizations have brought in millions and millions of dollars to our valley for much needed services like free HIV testing, mental health counseling, transportation for people with disabilities, pregnancy prevention programs for teens. The list goes on, and we're so proud to be even just a tiny part of those wonderful efforts that really show you how our wonderful community has come together to use this data to make concrete, beautiful programs happen that improve people's lives. All right, so now that you've had the background for our overall survey, I want to dive into this 2022 survey that we just conducted and show you some of the results. So first and foremost goes to our funders for this year. These are our funders who gave to HARC during 2021 and 2022, which, as you all know, were especially tough years for nonprofits and for giving and fundraising. So I'd like to give a huge thank you to our gold level funders, the S. Mark Taper Foundation, the Windward Fund, Eisenhower Health, who has supported us since day one, and the Center for Health Disparities at University of California, Riverside. On the silver funders list, you'll recognize a lot of our local foundations who are very supportive. Anderson Children's Foundation, Allen Foundation, our partners at Desert Oasis Healthcare, Impact Through Golf, which distributes the proceeds from the golf tournament, IEHP, our Inland Empire Health Plan, and of course our County Supervisor's Office, who helped us get not only community improvement funds, but also ARPA funds to support us. In our bronze level funders, you see several of our local cities who we are so happy to have as supporters, as well as College of the Desert, DAP Health, Desert Care Network, and Molina Cares. We're also supported by donations from individuals. If you find this data useful, I strongly recommend you go to our page and click donate. We would love to have you as a donor if you find this data useful. So in the past, all of our data was collected by phone survey. But phone surveys are really dying out. For example, in 2019, it took more than 500,000 phone calls and nearly a whole year for us to gather that 2,500 completed surveys, which is a lot. This is just not working because people are so reluctant to answer phone calls from unknown entities. This is a screenshot from The Guardian. It's a legitimate, actual thing that happened. A hiker who got lost in the mountains ignored calls from his rescuers because he didn't recognize the phone number. So that shows you just how intense the dislike of answering unknown numbers is, right? He's lost and waiting for his rescuers and doesn't even pick up the phone call from his rescuers. So how can I collect data when you don't even pick up the phone? So, like many other entities, including the California Health Interview Survey, we moved instead to address-based methods. Now, this is essentially paper surveys. So I'd like to do another poll and see if any of the participants, any of the 80 some odd people who are on this call happen to be one of the 2,790 who participated and completed a survey. So let's get that poll up. I expect the answer would, oh, I'm seeing some yeses. How exciting. So essentially what went out is a big envelope with the survey in English and Spanish, a letter describing what the survey is and encouraging to take it in English and Spanish, a $2 bill that was theirs to keep whether or not they took the survey, and a prepaid, pre-stamped return envelope so that it was easy to turn it back into us. These were mailed out by our partner Ace Printing, who is wonderful, wonderful, wonderful to work with. I strongly encourage any of you with your printing needs to go to them. We also mailed them a reminder if they didn't respond within a certain amount of time. So let's end the poll and share the results. It looks like some of you here are part of the 18,000 households we mailed this to. So thank you so much for participating in the survey. You are part of the reason we have anything to present today. So thank you. So in the end, we had a total sample size of nearly 2,800, and it was statistically weighted to represent our entire Coachella Valley of 430,000 people. So this enables us, we actually had some improved weighting this year. In the past, we weighted the data based on age, race, and ethnicity and gender. And this time we also added in geography, because as you and I all know, if you are in North Shore, your life situation is probably pretty different than somebody who lives in Indian Wells. And we also added in weighting for education. So the data is more robust than ever, which we're very excited about. So the executive report that we've been talking about will be available today. It's lengthy. It's more than 100 pages of information because we have more than 145 variables on this survey. That will be available on the HARC website this afternoon. Printed copies will be available in about a month. And I'm not going to talk today about all 145 variables. I think none of you have the time for that, and I think my voice would go out. So instead, I'm going to focus on some of the new variables, some things that changed over time, and some of the major health issues in the region, and honestly, just some of the ones that I find really interesting, and I hope you will find interesting as well. So let's dive into the adult research. We have about 330,000 adults in our community. As I'm sure comes as no surprise to you, nearly half are Hispanic Latino. We also have good subpopulations of other racial ethnic groups, so very diverse racially. We have 20% of local adults are living in households that fall at or below the federal poverty line. And if you do much work in health and human services, you know that the federal poverty line is incredibly, incredibly low. So that's 1 in 5 people who are living in very low income situations. Insurance in America is a big deal, right? It's almost impossible to get good continuity of care if you don't have health insurance. And you can see here that the percent of our working age adults who were uninsured was steadily rising and rising and rising. In 2013, 1 in 3 working age adults was uninsured. We made a little bit of progress with the Affordable Care Act in 2016. And actually, I shouldn't say a little bit, that was a lot of progress. You can see it was a huge drop in the percentage of adults who were uninsured. We lost some of that ground in 2019. And now we come to 2022. So I'd like to put up another poll and see how you think the rate of uninsured changed from 2019 to 2022. Because obviously 2019 to 2022 was a big issue because of COVID. So how do you think the percent of local working age adults changed? Do you think it went up, maybe say back up there to 25% or higher? Do you think it stayed there around 20% who are uninsured? Or do you think it went down and now it's maybe 15% of working age adults are uninsured, or even better? I'll give you another few moments to answer the poll. Okay, thank you all so much for participating in the polls. I love seeing an interactive audience. Okay, I'm going to end the poll and share the results. Looks like most of you think that the uninsured rate went up to 25% or higher, meaning 1 in 4 local working age adults is uninsured. Less of you think it stayed around 20, and then the smallest group think it went down to 15% or lower. So very interesting. Okay, now let's see what the data shows. So the data shows that we actually are at our lowest percent of uninsured adults ever. We're at about 13%, which is the best it's been in the entire 15 years since HARC has started tracking. However, a great deal of this is because of the emergency measures that applied to Medi-Cal during the COVID public health emergency. It meant that people who otherwise would lose eligibility for Medi-Cal could not be thrown off of Medi-Cal, and there was some serious expansion that went on. Unfortunately, that program will be discontinued in almost exactly 1 month, and many, many, many of these people will likely lose their healthcare coverage as a result. So while we made great progress and we're at the lowest point ever, I highly suspect that in just a few months, this will go back up because people will be losing that public health emergency or PHE coverage on Medi-Cal and become ineligible. Those of you who work in healthcare know that it's not enough to just have health insurance. You need to actually go get healthcare. And any care is better than no care. But of course, we would like it if everybody had a primary care provider that they visited regularly and had continuity of care and preventative checkups rather than I broke my leg, so I went to the ER. But both are good. If you break your leg, you should go to the ER. You can see here, we asked this question, when you are sick or in need of healthcare, where do you usually go? And typically, ideally, people would say a doctor's office or a clinic. But you can see that the popularity of doctor's offices has been waning over the years that HARC has tracked this. Whereas urgent care is getting more and more popular. This cycle, about a third of people got their usual source of care from an urgent care. This year was the first time that we saw a significant drop in the percentage of adults who said that their usual source of care was the hospital or the emergency room. So it went from consistently being about 10% to now it's about 5%, which is exciting. That's an improvement. We don't want anyone getting their usual source of care at the hospital or ER. But it's worth noting that this change isn't across the board, right? It's disproportionately affecting low-income people. Over 12% of people living in poverty are still getting their usual source of care at the ER versus less than 1% of those who are more financially stable. So it's important cross-examinations like this that can show us the wealth of interesting information about who is accessing care in which ways. We asked participants to tell us if any of a list of barriers had made it extremely difficult for them to receive care or completely prevented them from receiving care in the past year. You can see here that the length of time it took to get an appointment is the #1 barrier, which honestly, if any of you have called for a doctor's appointment recently, probably doesn't come as a surprise. This is likely related to the healthcare provider shortage. As many of you know, all of California has less doctors than we would like, given our population, but the Inland Empire, of which Coachella Valley is a piece of, has a special dearth of doctors. And so the ways to really recruit more providers is either to grow your own with pipeline programs or to bring in more residency programs, because doctors tend to practice either where they grew up or where they do their residency. And if those two places are the same, you have a win-win situation. So we have many wonderful organizations who are working on that pipeline programs to try to get our local youth interested and engaged in health and wellness and making a career out of those. We also have a lot of great healthcare organizations who are implementing and expanding their residency programs. So slowly but surely, this should chip away at our healthcare provider shortage and hopefully in some years take down the length of time it takes to get an appointment. I find this an interesting, a sexy topic, if you will. When looking at sexual activity, locally compared to Riverside County as a whole and California as a whole, our Coachella Valley adults are more likely to have been celibate. You can see the teal bars here. 39% of our local adults have not had sex in the past year, which is significantly higher than Riverside County or California. But of those who are sexually active, they are significantly more likely to have multiple partners as versus just one partner. And you can see that in the green. Of our adults, 9% had multiple partners versus in Riverside County, it's only 5%. So it's an interesting dichotomy that provides some insight into how we teach sex education and how we go about intervening with safe sex. All right, coming to one of our popular topics of COVID. I was really surprised by this, is that 27% of local adults have never been tested for COVID, which seems high to me. But then it turns out it's very similar to rates across the county and the state. So many people still have not been tested. Of those adults who have been tested for COVID, about 47% tested positive at least once. So this just speaks to how widespread this pandemic was and how many people in our communities were affected. We also asked about vaccine status. Fortunately, as you can see, 84% are fully vaccinated against COVID. But at the other extreme, 10% said, I'm not vaccinated and I have no plans to get vaccinated. So these are people who are likely very difficult to shift their opinions because of how much education and effort has been put into educating people these past 2 years on the importance of getting the vaccine. These people likely have very entrenched ideas, and it will be very hard to shift and to convince them to get vaccinated. So they are still at risk for contracting COVID and for transmitting COVID. COVID didn't just impact our health, but also our life. So you can see here, about 13% of employed adults had lost their regular job during the pandemic. But even greater, 1 in 3 had a reduction in their working hours or a reduction in their income. So that's a big impact, likely because we are so hospitality industry focused. Of the working people, about 1/4 were able to switch to working from home, but many continue to report for work. Again, that's likely due to the hospitality and the healthcare industry. I'm sorry, you can't be a nurse from home. You have to be there taking care of people. And the same goes for cleaning or for landscaping. It also had some extensive impacts on everyone, right? About 20%, so that's about 1 in 5, local adults had financial difficulties paying for their basic necessities. And 17% had financial difficulties paying a rent or mortgage. So this really underscores the importance of rental assistance programs, rent forgiveness, and any food support services. Anything that is still providing that is very important because it's not over. Moving on to major disease, our top most common major diseases haven't changed much over HARC cycles. It's been high blood pressure, high cholesterol, and arthritis for a while. But what's interesting is the percentage of local adults who've been diagnosed with high blood pressure and high cholesterol has really started to climb. So this goes again to the number of people who we have and the number of providers to treat these issues and making sure that these people are getting preventative care. As somebody who has both, it's very important to have that monitored by a provider. Moving to mental health, which is just as important as physical health, 20% of our local adults have been diagnosed with 1 or more mental health disorders. And the most common being depression, anxiety, followed by PTSD or post-traumatic stress disorder. However, not everybody is lucky enough to get diagnosed. Like we said, some people are uninsured, some don't have a regular source of care, so they may suffer from undiagnosed mental health issues. To capture that, we asked if people had had an emotional, mental, or behavioral problem in the past year that concerned them, such as stress or depression. And you can see here that 1/3 of local adults do. So anybody who had a mental health diagnosis or a concern such as this, we asked them if they were able to get the mental health care that they needed during this past year. More than 19,000 people were not able to access the mental health care they needed. So this is a strong indication that we need not only more providers, but also more providers who accept Medi-Cal and more providers who can offer low to no cost mental health counseling for people, because it is a major, major unmet need in our region. So to measure obesity, we don't say, hey, are you obese? Because nobody likes to think of it themselves that way. Instead, we ask people for their height and weight, and then we calculate obesity using body mass index or BMI. BMI isn't a perfect approximation of obesity, but it's a very close one and it's a very good one. And unfortunately, 67% of local adults have a BMI that puts them in the overweight or obese category. So 2 out of every 30. That's not great, but it's not disproportionately bad compared to the rest of the state and the nation. Unfortunately, all Americans are really struggling with these obesity rates. But one problem that will probably keep it from being fixed is a perception issue. Of the adults who are overweight or obese, about 51% of them think that they're about the right weight. So this exhibits some either denial or a lack of education about what obesity looks like. Perhaps they're thinking, oh, obese is if you weigh 600 pounds or more, not thinking that this is what an obese person looks like. So the people who don't think that they're overweight or obese are very unlikely to start any changes, to make any lifestyle shifts. So any programs tackling adult obesity really need to start with education and opening their eyes to what obesity actually looks like. Another potential barrier is the built environment. We asked adults whether they feel that they have a safe place to walk, bike, or hike in their neighborhood. And this cycle, 15% said no, they did not. So it's very difficult for that 15% of adults to get sufficient exercise when they can't go outdoors safely. So this could possibly be addressed by more sidewalks, lighting, lower speed limits, that sort of thing to make it a safe environment. Food insecurity was one of the topics that you all said you were very interested in, which is why I'm excited to share this data. Likely because of the pandemic, there has been a significant uptick in food insecurity for our local adults. More and more adults were worried that their food would run out before they got a chance to buy more. They said that their food just didn't last. They said that they had to spend less money on food because they had to prioritize other basic needs, and they had to cut the size of their meals or skip meals due to lack of money for food. Very widespread food insecurity increase. Fortunately, we did also have more people who were utilizing food support systems like CalFresh, which is known as food stamps, or Women, Infants, and Children program, and more people were getting food from food pantries. But the increased demand really means that the programs and services we have in place to serve people who are food insecure need to not only be sustained, but expanded, because this is not going away anytime soon and needs attention and resources. Two of our new variables this year were racism and intimate partner violence. On racism, we found, unfortunately, that 40,000 local adults have been treated unfairly due to their race or ethnicity. And regarding intimate partner violence or domestic violence, we have 1.9% of adults said yes, they had experienced that in the past year, which sounds very low and is great and wonderful, but that equates to nearly 6,400 people. And when you think about providing protection and shelter and resources and counseling for more than 6,000 people, it suddenly doesn't seem so low anymore. So, and it's likely an underestimate because of the stigma related to domestic violence. So both of these focus on the need to continue education and resources in these areas. Air quality is another new topic. We asked people to rate the air quality in their own local neighborhoods. And you can see most people here are around good or very good, but there are some at the extremes. We asked another question that I would like to see in a poll. So if you put up the poll about air quality, this is verbatim the question that appeared on the survey, a separate question, is does poor air quality ever stop you from doing outdoor activities in your neighborhood? So essentially, is it too windy for you to go jogging? Is there too much pollen for you to go out and walk your dog? Is it too dusty for you to play soccer with your kid in the yard? How often does that sort of thing happen? So I'll give you a few moments to answer. I personally think I'd probably fall into this several times a month category, because when it gets blustery and the dust is up, it's just so hard to walk my dogs. It's like breathing in sand. Okay, you see participation is still happening, but slowing. Okay, I'm gonna end the poll and share the results. It looks like about half of you, this happens to you several times a year. A lucky 15%, this never happens. And I'm really pleased to see that none of you said not applicable. I don't do outdoor activities in my neighborhood, because outdoor activities in your neighborhood are a good thing. But we do have about 10% who said yes several times a week. you're prevented from doing outdoor activities in your neighborhood. So let's see how that compares to Coachella Valley as a whole. Pretty similar, actually. Although in Coachella Valley as a whole, we had 9% who don't do outdoor activities in their neighborhood. And a lucky 48% who said no, never. So it looks actually fairly different. I was getting the yes several times a year mixed up with the no, never. So I'm jealous of the people who said no, never. I might need to map that and look at where that is. But that reflects a reality for our communities that is something we have to deal with in terms of any interventions on outdoor activities. And we all know that the summertime is a whole other can of worms. Okay, so I'm going to move on to the children. We have nearly 90,000 children in our valley, and the majority of them are children of color. So any successful programs need to be led by leaders who look like our community, which means people of color. And 31%, so 1 in 3 children live below the poverty line. And again, as I mentioned, that's really, really low bar. Another third, and actually more than that, live just above the poverty line. So less than 200% of the federal poverty line, which is still very, very poor. So this emphasizes that any programs and services directed at our children really need to be focused on low to no cost, because otherwise it's not accessible. One sort of hot topic that we measure is adverse childhood events, or ACEs. There has been a lot of research that has shown that adverse childhood events are correlated with events later in life, so that if the child is experiencing a lot of ACEs, they are more likely to be incarcerated. They have typically lower incomes. They even have shorter lifespans. They're more likely to die young if they experience these adverse childhood experiences. It has long-lasting consequences. So it's in all of our best interests to try to minimize the ACEs that a child experiences, and to try to combat any ACEs that are experienced with teaching them resilience to that adversity. So in this particular survey, we asked 3 ACEs questions, all within the household instability section, whether there was substance abuse in the household, mental illness in the household, or an incarcerated household member. So that's just a small portion of the ACEs. We didn't ask any questions about abuse or neglect because we were talking to the parents, and that would likely be underreported. We found that about almost a third of our children have experienced one of these 3 ACEs, which is pretty high. But the most common one of those is having someone in the household who is depressed, mentally ill, or has attempted suicide during the child's lifetime. So this illustrates the need for stigma reduction and education and intervention on mental health, because even if the child isn't having mental health issues, most of them know somebody, a family, a friend, someone in their household who is mentally ill or has suffered the consequences. So this really needs to be something that we start talking about and stop trying to ignore or thinking that it is shameful. Fortunately, the majority of children are insured, 90%. That's worth celebrating. However, 10% of our kids are uninsured, and that's very disturbing because every child should be eligible, is eligible for Medi-Cal, regardless of whether they're documented or not. As we saw on the first demographic slide, the vast majority of our children are very low income, meaning they're eligible for Medi-Cal. But we still have 10% who are uninsured. That is significantly worse than California as a whole. Less than 2% of California children are uninsured. So we have a ways to go to make up and make sure that our children are getting successful access. 79% of local children had a routine checkup in the past year. Again, good news, which we should celebrate. But that means that 21% did not. And when we asked the parents and guardians, why didn't the child have a checkup? it was interesting to see that the responses really reflected themes like, well, the child is healthy, so there's no need, or there's been no health problems, or there's no reason to take the child in. So it really reflects a lack of understanding of the importance of preventative care, especially for developing children, to make sure that they're hitting all of their milestones and that we can catch issues early on and address them before they become big problems. So that isn't a definite intervention point for potential parents, is to educate them on the importance of regular checkups for their children. Much like the adults, their usual source of care is the doctor's office and the urgent care and the clinic. And 84% of our local children have visited the dentist at least once. Again, we need to celebrate these good things. But what I find interesting is, I didn't know, it's recommended that all children go visit the dentist for the first time on or before their first birthday. And we are not seeing that. Only about 14% of kids who've ever been to the dentist went before their first birthday. So the majority of our local children are going when they're 3 or 4, when they're a little bit older. So again, this is a potential intervention point and education point for the parents as to, yes, they're baby teeth and they will fall out, but you should still go to the dentist early on and start that dental care. We asked about whether children ages 1 and up had been vaccinated for COVID. So a little over half are fully vaccinated, as you can see here. But what I am concerned about is that 23% said, no, the child is not vaccinated, and I don't plan to get the child vaccinated. So that's more than 19,000 children who are unvaccinated and whose parents have no intention of getting vaccinated. So they are still at risk for continuing to contract COVID and to transmit it to others who may have serious health issues. So these high rates, it's sort of interesting that 10% of overall adults said, no, I don't plan to get vaccinated, but it's much higher for when parents are thinking about their children, which is concerning, to say the least. In terms of safety, about 9% of our local children do not have a safe place to play outside. But the second one is the one that really gets me. Drowning is the leading cause of unintentional death for children under the age of 4. And so swim lessons are very important. I can only imagine that it's higher here in the Coachella Valley because of our warm weather. There's pools in every apartment complex, every housing complex. They're very, very common throughout our region. However, 39% of kids aged 2 and up do not know how to swim and are at high risk for drowning. So this just emphasizes the importance of having water safety classes and swimming lessons for all children. Again, low to no cost is super important, but making sure that we can prevent, drownings that would be extremely tragic in our region. Mental health, this section is only asked about children who are age 3 and older because it is extremely hard to diagnose toddlers and infants with mental health issues. But about 25%, or 1 in 4 children, have difficulties with emotions, concentration, behavior, or getting along with other people. And a similar amount have been diagnosed with 1 or more mental health disorders. The most common, of course, being ADD and ADHD, followed by anxiety and developmental delay. Measuring obesity for children is a little more complicated than it is for adults because children's bodies are changing and growing so fast. So once again, we ask their height and weight, and we use that along with age and gender to calculate BMI for age percentiles, which you can see in this beautiful graph off to the side is a little bit more complex. And we only do this for children ages 2 and up. Obesity ratings for children under the age of 2 definitely require a hands-on measurement type of thing that you can't just report on height and weight. So after doing these calculations, we found that 55% of our local kids age 2 and up are overweight or obese. So they're doing better than the adults. For adults, it was 67%, but still not great, still over half. And a real sticker in the issue is the parent-guardian perception, right? So of those children who are overweight or obese, 78% of their parents or guardians think they're about the right way. And so they are very unlikely to instigate any sort of behavior change. They may think, oh, a chubby baby is a healthy baby, or it's just baby fat, they'll grow out of it. Not realizing that data has shown that if they're a chubby child, they are highly likely to grow up to be a chubby teen and then to become a chubby adult. Obesity tends to have long-lasting consequences. And since it is linked to some of our major leading causes of death, like heart attack, cancer, stroke, this is a serious issue. And more than just, my kid has cute chubby cheeks. So again, much like the adults, any interventions tackling childhood obesity need to start with parental education. What does obesity look like in children? Does it look like your child? And if they are, why is that not okay? Why should we change behavior? Why should we strive for healthier food, more activity, more exercise? So there needs to be a large education component of any interventions. Much like the adults, food insecurity went significantly up from 2019 to 2022, likely as a result of the pandemic. We have more local children who are living in homes that are suffering from stress. They're worried that their food will run out before they have a chance to buy more. The food that they bought just didn't last. They had to spend less money on food because they had to prioritize other basic needs. And our children are having to cut the size of their meals or skip meals due to lack of money. This is not great, as I'm sure you all agree. Fortunately, again, like the adults, they are more likely to be utilizing CalFresh and WIC and food pantries, which is wonderful that we have those resources. But it just continues to emphasize the support we need to be giving to programs and services that provide food supports, because it is by no means over, and we absolutely need to address this. Children who are hungry can't learn in schools. They can't participate in their sports. We absolutely have to make sure that we're addressing child hunger here in our valley. One of my favorite sections asks whether children ages 6 to 17, whether the parent or guardian or any other adult in the home has talked about a list of important topics with their child. And you can see the 5 most commonly discussed here on the left and the 5 least commonly discussed on the right. And last cycle, when I was presenting this, it was a very sharp dichotomy, right? People were either talking about it with their kids or they weren't. And what we saw this cycle is this uptick in more parents talked about just about everything with their child. I think it's likely because of the pandemic and going to school from home. Whereas a child might normally have this conversation or ask a question of a teacher or a coach or a mentor in an after-school program, during lockdown, all they had was their parents to ask. And so parents all of a sudden had to come up with responses to these questions and start talking about these difficult topics. So all of these increased. The ones that increased the most were the amount of parents who are having conversations about depression and isolation and suicide. Those almost doubled the percent of parents and guardians talking to their kids about that, which I personally think is a positive thing, because as we saw, you have 1 in 4 kids who have a mental illness. 1 in 5 live in a household with somebody who has been mentally ill. This is something that's happening in everyday life. And so it's something the child needs to be equipped to talk about and to respond to with resilience and with understanding and not with fear. So I think the fact that these conversations are happening more and more often is a wonderful sign. We're better to learn about it than to learn about it at home. I'm sure the parents who had to have those difficult conversations possibly feel differently than I do, but I think it's a good sign that more of these things are becoming acceptable to talk about so that the kids aren't frightened by them. Okay, so that's it. As I said, I'm not going to go over all 145 data points. Instead, I'll talk a little bit about what's next. So our executive report, in case you want to look at all 145 variables, that will be available on our website this afternoon. I'm hoping by noon. That depends on our wonderful Teresa Sameh. I think she'll be able to make that magic happen. As with our previous reports, it's totally free. This data belongs to you as much as it belongs to anyone, But we will ask you to take a short survey. Just tell us who you are, what you plan to do with it, and whether you've had success with our data in the past. I know it's a pain to fill that out every time that you download the PDF, but please, please, please take the time to do it. It really helps us to measure our impact and how we, in some small way, contribute to the successes in our valley. So please do it. Also, you may notice that our website is a little shaky. We are overdue for an upgrade and are investigating that. So hopefully in a few months, it'll be bright and shiny and new and beautiful. But for now, it's old and a little slow. And I'm hoping having everybody go to the website to download the report won't crash it. But if it does, please be patient or try again tomorrow. I promise a better website is coming soon. We'll also have printed copies of the report available next month for all of you who are on this call, in case you want a nice one to hold in your hot little hand. I know I'm looking forward to seeing those. And if you're looking at this data and you're thinking, wow, that's cool, but I want to know that statistic, but just for seniors, or just for women, or just for low-income Hispanic people. Great, we have the data. We can slice and dice it any which way. So if you need one of those drill downs, please contact us. I put my email address here, but because my last name is long and often misspelled, I also put Casey and Chris, since they have short, sweet, and to the point last names. You can reach out to any of us and we will work with you to try to get you the data that you particularly need. It may not be possible, but we will absolutely explore it. And we're happy to provide that for you. We'll also be doing special reports. Thanks to the generosity of the Windward Foundation, we have an upcoming report that will be out in June on environmental justice. It's going to include some of our new data on air quality and desire to change for the environment, but it's also going to include some community engagement with people who live locally and who are affected by the air quality. So it's going to be very fascinating, and I'm excited to share that with you all in June. We'll also be looking for funding to dive into other special report topics. In the past, we've done special reports on seniors and children, veterans, people who are Hispanic or Latino, people with a mental health disorder. So the possibilities are not endless, but they're numerous for sure. So if you have a specific topic, please email us or drop it in the Q&A and tell us what special reports are you most interested in? What would be most useful for you to see? And then we will try to find funding to do that special report. Or if you know of any place that might fund a special report, we're always excited for that information as well. All right, lastly, here is our contact information. I highly encourage you to check us out on social media. I promise you we make data fun. It's been managed by our lovely Amairani Ramos and is about to transition to Bernardo. So please make sure he has a responsive audience to learn with. And now, if you all have any questions or concerns or any issues about the survey, I invite you to put those in the Q&A, and I will stop sharing my screen and have Chris, our lovely senior research associate, help me out and cover some of those questions that have already come in. So please continue to add any questions to the Q&A, and Chris will read out some of the ones we already have.
Okay, I do see some great questions coming in. Thank you for an excellent presentation, Jenna. As she mentioned, yes, please go ahead and enter any questions you have into that Q&A. I do see some more coming in. For our first question, Jenna, were the unincorporated communities of the Eastern Coachella Valley included in the sample size?
Yes, absolutely. That's a very important community to us to capture. And so we did have participants from Mecca, Thermal, Oasis, and North Shore who participated and who were weighted as such to represent their full communities. We've done a lot of projects, like our upcoming Salton Sea asthma study will be focused strictly on Eastern Coachella Valley unincorporated communities, actually, and Imperial County unincorporated communities like Salton City and Bombay Beach. But it is definitely a large focus of ours and cannot be left out because some of the health needs there are very, very intense, I would say, and also unique to that area. So yes, they are represented in our data, and we do continue to make them a priority on other projects as well.
Okay, and let's see. Our next question we have, can you share any data regarding depression and anxiety levels among Coachella Valley seniors?
See, that's one of our requests for a special analysis, and I absolutely can. That is one of those things I can say right off the bat. I can investigate that and share with you. So please do shoot me an email offline, and we can explore that data together.
Okay, and it looks like someone else is also hinting at splicing and dicing the data. Would like any research on low and no vision throughout our regions?
Low and no vision, we do have that included in the executive report. I do strongly suspect that it is a underestimate this time around, because the survey was done on paper. Now, somebody in the household who's low or no vision could have somebody who has vision fill it out for them, because we instructed it to be the person with the closest birthday. That is the random sampling technique that is generally accepted as the best practice. So it may represent them, but if they live alone, or if they didn't want to, or if somebody in their house wasn't willing to fill it out for them, it may be an underestimate. So I believe you'll see that the data is about 4% of our local adults are blind or low vision, whereas last cycle it was up to, I think, around 10%, which is probably a more accurate capture.
Okay, for our next question, in terms of access to healthcare, is there any data related to specialty care such as OBGYN?
You know, that's a good question. We do have questions about women's health exams, whether somebody has received a pap smear or a mammogram in the timely manner that they are recommended. So that sort of gets at it. We also have questions related to specialists in the diabetes section, how often they've seen a provider for their diabetes, how often a provider has checked their A1C levels. So while there's no specific question, how do you get your specialty care? There's sort of several questions that get at that, and that show how many people are able to get that specialty care versus not able to.
Can you share any data regarding asthma and missed school days for children in the Coachella Valley?
Yes, that is absolutely in our report. You'll see, I think you'll be surprised I don't have every one of the 145 variables memorized, but I think it's about 10% of our local children have been diagnosed with asthma. And I think about 12% of them have missed school days in the past year due to asthma, which, if you think about how flexible the schooling has been, and the ability to participate online, that's pretty substantial. So that information is in our executive report, so you can see that later today. And as I mentioned, we'll be working with UCR to do a more in-depth study, not of asthma diagnoses, but asthma symptoms, because it may be that some local children have not been diagnosed with asthma, but they are experiencing those respiratory symptoms.
Do you utilize other information such as census data in developing your report?
That's a good question. So it is weighted to the census data, particularly whenever we are crafting questions. We try to mirror the California Health Interview Survey, which is conducted by UCLA and also freely available. That is the data you will see that represents comparing our Coachella Valley to the Riverside County and to the state of California. That allows us to see where there's disparities. Where are we doing great? Where are we doing not so great? So we do try to mirror their questions as much as possible. You'll see in the report there are sort of horizontal bar charts. Every one of those that appears is comparison to an outside resource and comparing to other data. So, and then the census data comes in not only in the background information, but also in the weighting to make sure that it is taking that into account and making our data better and stronger.
So it looks like we got a couple of questions related to special report topics. Do you have any data specific to Eastern and Coachella Valley community?
So the data is designed to be representative of our entire Coachella Valley region, not any one city or any one unincorporated area, et cetera. That being said, like I said, with the slicing and dicing, if there is a sufficient sample size, we can start to look at a particular geographic area. In the past, we've had good luck looking at, if you define Eastern Coachella Valley as Indio, Coachella, Oasis, North Shore, Mecca, Thermal, that grouping is usually large enough for us to get some data and statistics on and be able to report out with certainty. So I hope to be able to do that going forward. But then again, I also hope that we can develop that data from other resources as well, because I agree that it's a very interesting and high need community that we should study.
Okay, it looks like our questions are slowing down a bit. Let me see if I can pull a few more out of here. Another sort of special report kind of topic. Someone said they would like more specific data on suicide depression with children, specifically between the ages of 5 through 17.
That's a really interesting topic. Often I'm called upon to give lectures not only on our data, but other people's data. And some of the most strong reactions I get are to not our data, which is the data developed and collected by the California Healthy Kids Survey. That particular survey used to be every other year or every year in schools. And as a bummer, it's now optional, and many of our school districts have chosen not to continue to do it, which is unfortunate because it gathered great information from the children. That particular survey, and older copies are still available online for free from the Department of Education. You can look at how many of the children said that they had seriously considered suicide in the past, I think it's 3 months, and it is distressingly high. And that data is usually, I think, for 9th graders and 11th graders. Very, very concerning high. We don't have that in our data set because we're talking to the parents. And unfortunately, the parents are often the last to know, and we don't want to underreport on it. So we can tell you how many parents talk to their children about depression and suicide, which, as I mentioned, has really increased, which I find to be a good thing. But in terms of how many children have actually considered suicide or felt depressed, the California Healthy Kids Survey is a great resource for that. And I encourage all of you to lobby your schools to continue to conduct it, because it's very useful information that I think is collected in a very competent manner. So if you have any influence over your local schools, please tell them to keep doing that.
Okay. A couple of more very good questions just came in. What inspired HARC to do this amazing survey and to continue providing this important information?
Oh, what a good question. You know, I can't speak. Perhaps I should unmute. I think Eileen's on this call. Our founder, Eileen Packer. The data collection was really inspired because we care about this community, right? We live here, we work here, we play here. We need to be able to measure health and measure needs and then address those. I think there's, you cannot actually tackle and make improvements unless you have measurement. And this is that measurement. So we are so dedicated to continuing to provide this important information, regardless of whether our funding is cut or whether it's crazy to give away your primary works product for free. This is really important to us and to HARC's mission is, providing this information to make communities better and give all of you the tools that you need to do your fabulous work.
Okay, and someone has a question about specific reporting. Is there a cost associated with these specific reports?
That's a very good question. And yes, my board members who are on the call will all say, yes, Jenna, you need to bring in revenue. And they're right. Typically, a full special report, we usually seek out funding in the $10,000 range. And we found that many of our funders are willing to do that so that the data can then be free to everyone. So if you are interested in a special report and you want to partner with us to try to find somebody to pay for it, we would love to do that. We can probably produce a data brief or something that's just 1 or 2 pages at no cost, but it all just depends on how many hours go into crunching those numbers and writing those reports and creating those graphics or those maps. So yes, the special reports are not free for us, but thanks to many generous funders, they are often free for all of you to access after we get that funding. So we will always continue to strive to find funders who also prioritize health and wellness in our Coachella Valley and who are willing to pay for the general population to have that data for free.
Okay. Do you capture any tobacco data for the Eastern Coachella Valley?
Very good question. So we've asked a question on cigarette smoking for many, many cycles. And it is actually higher here in our Coachella Valley than it is in Riverside County or California, which actually kind of surprised me. I don't see that many people smoking cigarettes. We also added for the first time this time a question about other tobacco use, whether that's vapes or cigars or hookah. And so we have that data as well. And that's for the whole Coachella Valley, not just specifically Eastern Coachella Valley. But again, if we want to look at just Eastern Coachella Valley, we could probably do that depending on where we cut the data to make sure that we have a large enough population to really be confident about our responses. So yes, that's another one that you should contact me afterwards and I can slice and dice and hopefully give you what you need.
Is there a pamphlet you guys are getting together for us to talk to our children about and encourage us to stay and be healthy?
Oh, that's a very good question. I am an expert at measuring things, not necessarily doing health education. I would say many of our wonderful partners on this phone call are experts at that. I would tap our friends at InnerCare, which is formerly known as Clínicas de Salud del Pueblo. They provide wonderful resources as to how to, wonderful resources on community engagement and education. And I think they would be much more qualified to create such a pamphlet. I think it's likely that Kaiser might also have some good resources, as well as IEHP or maybe Molina. I'm just looking at who all is on here, who I can connect you to, because they are doing the day-to-day interacting with kids and health education, and they're much smarter about it than I am. So I would say we could, but I'd rather leave that to the experts who work with child health education every day, because we have so many fabulous ones in our desert.
Okay, it looks like our questions are dying down. If you have any remaining final questions, please throw them into the Q&A. We do have an interesting one, Jenna. Someone wants to know what type of water you're drinking.
Ice water all the time. Yes, I normally have my giant water bottle, but I felt like that would cover up my whole face. So I'm trying to not spill this on my keyboard. But yes, hydration is a very important aspect of life. That's a good health tip that possibly we should start measuring, is how many people actually drink enough water. All right, well, thank you all so much for coming and for being here. We will send you all an email with a link to the report, or you can check our website to refresh quickly and see if Teresa has been able to put it up. Again, please be patient and please do fill out the survey about you and how you plan to use this data. We are absolutely available to you at any time via email. We're very responsive, except for this afternoon. I'm going to go take a nap. But I promise, if you have any special data you want to see sliced and diced, or if you have any special reports ideas, or if you just have a question and say, hey, I don't see this in your data, do you know where else I can find it? We're here to help with that too. So basically, if you have data needs, please do come to HARC. That's part of our job, is to help you with that. And we are here to be a resource for all of you. So thank you so much for making time today. We so appreciate it. And we look forward to seeing what all of you do with this data, because I know it's going to be great things. Oh, and Teresa says that the report should go live on the website at noon. So should be ready for all of you. Thank you so much and have a wonderful day.